Afternoon to you, and thank you for your time. What kind of work are you expecting these health professionals to do?
We are expecting them to do what our mandate is with this, which is mainly to preserve and saving lives by providing quality healthcare to our people so that we can see ourselves having a long and healthy life for the people of Limpopo.
Are you expecting more nurses or more doctors? I presume a little bit of a mixture of both.
I think from the 528 that we welcomed today, it was mainly our medical doctors, our radiographers, clinical psychologists, all clinical support services, dentists, and in the next month, which is February, because the curriculum for the nurses differs. The end of the year will be end of March, so they will only resume their duties as whether they have completed their community service or as community service with effect from the 1st of February. So this time around, it was all other categories with the exceptions of the nurses.
Do you expect it's going to make a big difference? I mean, in a way, I think some people feel the pandemic is over. I don't know if it's really right to say that. I think we need to be, I don't think we can say that the pandemic is over. But is this going to make a big difference to what you're seeing in your hospitals at the moment?
Yes, it's not necessarily about the pandemic. If you remember, we have always been raising that the pandemic itself has exposed our healthcare system that indeed the shortage of staff is dire. You remember that most of the time when we're dealing with any wave, you will have when the healthcare workers themselves are sick, and you find that one, it's left to mend a ward on their own, and this has been strenuous to the healthcare professionals. So these injections of these healthcare professionals will go really a long way in making sure that we focus on what we are supposed to be doing, being the Department of Health, meaning that our focus will be on preventative healthcare so that we reduce so many people who get to complicate and get to be sick. Because we have learned a lot from COVID to say, even if you have got limited resources, as a province like Limpopo, if you have to go all out and make sure that you put strong strategies, whether it's communication, talking to your people, letting your people to understand and know how this disease spreads, how this disease will complicate. So if you teach people the basics, so this is the approach that we are doing in all other burden of disease, whether it would be a burden of disease out of trauma and road accidents. We'll be working with the South African Police Services, the Department of Community Safety and Transport to make sure that we reduce those burden of disease out of trauma. Whether it's diabetic, we'll be going all out. Our dietitians that we've welcomed today, we are going to put some of them in our clinics to start teaching our people about how to eat healthy diets. Any healthcare professional must understand that the word health means you must keep your community healthy and safe. If you do that, you are not going to complain about the shortage of resources in our hospital. So these are the kind of healthcare workers that we want to see ourselves employing moving forward as a department.
It's interesting that you're able to do this, MEC. I mean, it's good news that you're able to do this, but I say that because in the last week, in the Eastern Cape and in KwaZulu-Natal, nursing unions there have been complaining that nurses are not being given permanent posts. And both of those departments have said, as I understand it, and I remember well the Eastern Cape head of the health department speaking here on Newzroom Afrika, Channel 405, saying they just didn't have the money to employ people permanently. The reason I say this is that how do you think you've been able to employ people? I mean, I can't imagine that you have more money than the Eastern Cape and KwaZulu-Natal. Other provinces are battling. How have you been able to do it?
We don't have. We must indicate, and we must indicate that the bulk of those that we have appointed today would be some of them on the 12-month contract. But we are working with our provincial treasury to reprioritize. If you remember, Stephen, last year and the year before, we were under fire from the labor youth movement when we start to look at other ways on freeing money. whether it's money for over time, to say how do we make savings in those areas so that we can be able to bring money towards making sure that we appoint healthcare professionals. We also, at the same time, have always raised this issue that the Department of Health in Limpopo has been spending more than 76% of its budget towards compensation of employees. And when you look at this staff establishment, who are those employees? You either would have a bloated part of your management, everybody being a chief director, who sometimes is just a warm body and not necessarily adding value. And you will find that you've got so many directors, and once you have a chief director, he must have 2 or 3 directors, who must have deputy director, assistant directors, the PAs, the senior personnel officers. So we have already started that work, because if you can go and look at from where I am, when I started in the previous admin, I used to have 8 DDGs. I'm left with only the DDG for health branch, the tertiary services, and CFO and corporate services. So we have reduced them by half. And that is a work that it's being done with the chief directors and all that. We're doing that to free money so that we can appoint the people who are responsible for the healthcare. This is a core business. We have challenges of cleaners, not only about the healthcare professionals, cleaners themselves, switchboard operators, food service aides, all those are very critical towards running a quality of care. So we are working with Treasury, and the challenges that is facing Eastern Cape, we are facing the same challenge. They are not unique to Eastern Cape and KZN. They are across the provinces. And this is where we're making our call as the National Health Council for the Treasury to start realizing that COVID-19 has told us that putting money on health is an investment. If you really, a country that does not look after its health does not really understand what investment is all about. So we're working there. It's a step in the right direction, but it's going to be a long journey because, of course, when you want to reduce the structure, you now are tampering with some of your labor unions whom I always ask, why are we really so focused on managers who are men instead of the workers that we really need? Because you can't have an army which is bloated in terms of the generals when there are no foot soldiers. Generals give instructions, they hardly carry guns. So that's what is happening. We need nurses who are going to carry those injections, and those who are going to do health promotion, those who will work with me across villages, across the schools, everywhere where there are disease, so that we can fight them. Instead of having generals who will be sitting in my offices and giving instruction. I know it's a painful situation because you are talking about human beings, and for you to retrench someone or for you to rationalize the staff establishment, it's a sensitive matter. It usually backfires. So that's why another thing lastly is that through the Premier's office, we have made a call to other departments to say, really, there are some people who are misplaced in the Department of Health. They've been appointed previously, which was wrongfully so. Can they take them? Maybe they will add value in their different departments, because Limpopo Health, indeed, the staff establishment is bloated by people who we probably do not necessarily need as compared to those who must be the frontliners and those who actually, Stephen, how I summarize it, I always say, if during COVID-19 you were able to work from home in the Department of Health, you probably must think twice. Do I really need you more? But there are those who could not nurse the patients from home. There are those who could not operate patients from home. There are those who could not clean the wards from home. So those who were, even during level 5, were in the hospital. Those are the people that we need most in the Department of Health.
MEC, I really appreciate the time. Thank you. The MEC for Health in Limpopo, Dr Phophi Ramatuba. Important developments there, as you can see, an explanation coming through as well.